Okay, one thing real quick. I'm a retired police captain, so I spent 20 years and they send me a check every month. So I just wanted to point that out. Yes, I'm one of the co-founders of LEAP, Law Enforcement Against Prohibition. And why we came together as an organization in 2002 is because we see the failure of the policy of prohibition in our society. I was talking to somebody earlier today and they said, well, you think these gangsters will just become honest people if we legalize drugs? And my answer to them was no. The gangsters will stay gangsters, but most of the people that are involved in this illegal trade, you really wouldn't classify as gangsters. They're more like opportunists. To give you a quick example, in 1919, there was a homicide rate in this country. We instituted alcohol prohibition in 1920. The homicide rate in this country climbed every year until it peaked in 1933 when we legalized alcohol. And by 1937, the homicide rate in America was back down to the level it was at before alcohol prohibition started. And I want to point out one other thing about 1937. That was the deepest, darkest period of the Depression in this country. So there was a lot of angry people, but they weren't killing themselves anymore because we took the product away that they were killing themselves over. Legalization of drugs is not about the drugs. It is about the gangsterism and terrorism that is supported by the illegal marketplace in this country. When you institute a prohibition like we have with drugs in this country, what you are doing is not protecting people from other people. You are attempting to use law enforcement to protect people from themselves. Protecting you from yourself is a function of family, church, education, and the healthcare system. It never is and never should have been intended to be a law enforcement function. We are out there enforcing morality when we enforce drug laws, and that is not our job. We were not trained to do it. We are not capable of doing it. And if anything else, you see the failure of it. We've been doing this for over 40 years since Nixon kicked it off, and the drugs are more available, pure quality, and cheaper than they've ever been before on the streets of America. And we've had 40,000 deaths in Mexico in the last 5 years fighting over this drug trade. Plus, we've destroyed more lives than the drugs have by incarcerating people and hanging felony convictions on them and denying them college educations, denying them jobs for no good reason. We have the largest prison system on the planet. And I would like to point out one of the most efficient prison systems on the planet. And in that huge, efficient prison system, we do not have one drug-free prison in America. And if you cannot keep drugs out of prison, who is going to be delusional enough to think you can keep them out of a free society?
Oregon just became the first state in the U.S. to decriminalize drugs. That means that if you're caught with coke, meth, heroin, or any other drug for personal use, you no longer risk jail time. Carl Hart is a professor of neuroscience and psychology at Columbia University. He wants other states to follow Oregon's lead and go beyond it by making recreational drugs legal to sell and safer to use. He spent the last few decades researching meth and crack, and his latest book defends people who use drugs for pleasure.
So you wrote a book called Drug Use for Grown-Ups.
Yes.
So why should grown-ups use drugs?
Well, the full title is Drug Use for Grown-Ups, Chasing Liberty in a Land of Fear. And the subtitle is related to this issue of who we are as Americans. We say that we believe that each of us have these rights, life, liberty, and the pursuit of happiness, meaning that we can live our life as we see fit. That's not true in this country. Like, why, if you are a responsible adult, should your government be telling you that you can't alter your consciousness as you see fit?
So you're saying that people have a fundamental right to use drugs?
Adults have a fundamental right to behave or pursue whatever behaviors they like, as long as they're not bothering anyone else. Absolutely. Ask people, particularly middle class, privileged people, because I know they're using drugs because I've used drugs with a number of these people who are politicians, who are famous people, who are captains of industry. I asked them to come out of the closet so they could stand up on behalf of the people who have been persecuted, vilified, and so forth.
In this book, you talk about using heroin. Heroin has a big stigma around it. Was that hard to do?
I talked about it to make a point, to show that I'm not addicted, never have.
All right, so let's check out Portugal.
Now, we talked to you about the Portuguese experiment before and that it seemed that it was going well with the numbers. Well, a new report is out after 11 years of this experiment. How has it gone so far? Well, the numbers are in and they are astounding. Now, we were told by all the fearmongers, my God, if you decriminalize it, then the drug use is going to run rampant. Well, what about all these poor kids who suffer from drug abuse and their families, et cetera, et cetera? You're condemning them to a worse fate, et cetera. And we said, hey, listen, if you decriminalize it, doesn't necessarily mean that the numbers are going to get worse. They might even get better. I think they would. So what happened in Portugal? They got better. But they didn't just get a little better. They got much better. So, first of all, in the previous 10 years, the number of drug addicts being treated has dropped by half in Portugal. They cut the rate by 50%. What happened? I thought it was supposed to go up. No, there's far less drug addicts. And if you think that's an impressive number, drug-related diseases, including STDs and overdoses, have been reduced by an even greater number. So we knew that those numbers might be better if the government didn't criminalize it and treat it as some sort of thing that you should be locked up for usage, right? But it turns out even the addiction rates have gone down dramatically, and now the drug usage rate in Portugal is among the lowest in the EU.